Hello, good morning. Welcome.
Good morning. Welcome along to March's Webinar Wednesday from me, Pauline from In Control Scotland, and
me. Oh, it's like the two Ronnies, it? And
I
it's
know.
good from him. I know, yes. And Alistair also from In Control Scotland. So yes, another, our monthly updates. So so today we're gonna catch up a bit about the general news, and then we're gonna have a guest, aren't we?
We are. So regular viewers might have tuned in a couple of months ago when we had Barbara Morton from Scottish Government talking about the consultation for the National Care Service, and that has been a big process which has taken lots of information, and they've now gathered all that information and they're ready to share it with people. So Barbara's going to come along and talk about what they found out, which should be fab.
Excellent. So while before Barbara joins us in about 5 minutes' time, let's have a think about what else is going on. What else have In Control Scotland been up to? What other things are going on in the world?
Oh, we've been fairly busy, it would be fair to say. I think this is coming back after the Christmas break. We are at that point in the year where some of our programmes are coming to a close because we tend to do things starting in April and finishing in March. So we're tidying up a few bits and bobs, aren't we? We've got our final session for Working Together for Change coming up in the next couple of weeks, which has been a fantastic project to actually see it through all the way through this time, because it got interrupted by COVID last time we tried it, didn't it?
It did indeed. It's been it's been one of these things that it's stop-start, but it's been worth it. It's been worth going back to, hasn't it?
I think it has been. And what we're doing with this first group of people is we'll ask them lots of questions, find out what worked really well and what didn't work really well, and we'll be running that again and opening it up for a new bunch of change makers, probably starting recruitment just towards summertime for it starting again in the autumn. So that's exciting. And good morning, Liam. What else have we been up to? We've also been doing our programme of children and families lunchtime sessions, haven't we? So we've got one of them every Thursday.
And they've had really good engagement, and we're gonna run another bunch of lunchtime sessions from starting again next month, aren't we? So the DJs are joining us. We're just so hip and cool in our live streams.
We are. We just hide it well.
That's the crossover. That's the crossover with the Stay Up Late crew, which I guess we should mention. We have another another music event Friday night. It's just one of our little monthly ones rather than one of the big Stay Up Late bashes that we had quite recently for Burns Night. But yes, it's just one of our 1 hour sessions, 9 o'clock Friday night. Mm-hmm. And I think if anybody has still got any musical connections, anybody wants to put any new music in, then get in touch with us or get in touch with Michael McEwen, and we'll add you to the list, the guest list.
And that's still happening online for now, isn't it?
These are the monthly online music sessions. We are still starting to think about how we can plan our kind of in-person stuff. I guess we've got the last big one that we had was probably with Citizen Fest, the joint one way back in 2019. So again, we've got another Citizen Fest coming up, but it's going to be a hybrid one, isn't it? It's going to be kind of in person and kind of not. So we'll need to see how that plans out for the Stay Up Late element. But it would be really great to meet up in person. I think people are so missing it.
Yeah, although I quite like a wee rave in my living room with Bring On Glow Sticks.
Yeah, and it's good to have that kind of that mix of particularly people who are in diverse different rural locations who wouldn't make it through for an in-person one. So
definitely,
June's just catching us up with all the latest about what we're up to as well.
And as always, June will be keeping an eye on the Facebook chat. So if you've got any comments or questions, anything you want to ask, especially when Barbara comes on to talk about National Care Service, get your questions in and we'll try and answer them. But that's as we're talking about things that are ongoing and maybe coming to an end at this time of year, we're also planning some new stuff from April onwards, aren't we? We're going to the children and families lunchtime sessions have been so popular and so interesting conversations that we've had that we're going to start another set of lunchtime sessions on looking at areas out with children and families. So might be looking at a wide range of topics, particularly sharing the kind of work that we've been up to.
Yeah, and I think we've recognised that although part of the curse of home working has been you get no breaks, and this doesn't help really because it does encroach on lunchtime. But the good thing is it's quite an informal session, isn't it? You can drop in, drop out, so you don't have to commit to it. And I think that people, because it's not a massive length of time, and it's talking about really interesting stuff, it's attracted generally it's attracted really good viewing figures. So where is Keith today? You see, we're getting the hecklers. Keith's otherwise engaged. We take shotties. You see, we see who's there's a few of us about now. You see, so we can all take a shot. So I'm sure we'll do our best to try and do our best Keith impersonations. I'll have a go. No, I won't. I can't compete with Keith.
But what else have we got going on? The New Roots Home project to work towards people getting people out of long stay institutions. So there's been a wee bit of interest in the news about this kind of families who are going through being held in institutions out with their local communities and away from their families. And you've been doing a lot of work to try and get some work happening. There you go. Bring it up on the screen.
Yes. So this is for anybody who hasn't seen it. New Roots Home is just a collaboration of a bunch of interested people and organisations, and we've got this. This is we've got a little meeting calendar up there. So the 17th of March is our next meeting online, 3 p.m. And if you want to join us, there's email newrootshome@gmail.com or ncontrolscotland.org.uk that we could and we can put you right. In fact, there's probably an info in front of that, isn't there?
Mm-hmm.
Yes, indeed. I'll need to. But so have a look at this website if you haven't had a look at it. So basically, what we're trying to do is try to connect people who are stuck in the system where the support and services haven't lined up, and they're either out of area placed or at risk of out of area placed or something similar. And so it's not just about complaining about things, it's about actually making it better.
And who can come along to New Roots Home, Alistair?
It's open to everybody, absolutely everybody. So that's something that we're quite clear about, that it's not one particular group only, and everybody, it's about a collaboration as usual. So we've got Keith watching, you see.
And as well, actually, speaking of things that anybody can sign up to or get involved in, it's worth mentioning we're still involved in the SDS Collective, aren't we, which meets every 2 weeks for formal meetings and in between weeks. So there's something on every week where there's informal sessions talking about a particular topic. This week's one is on dementia, isn't it? The self-directed support for dementia. And that's a really nice space for people. We've got parents and carers of disabled children. We've got disabled self-advocates. We've got folk working in organisations like Uncontrol Scotland, support providers. Anybody and everybody is welcome to that, aren't they?
Yeah. So, and again, with that in mind, that is what we're all about, isn't it? It's about not just coming at things from one angle, but trying to get everybody connected and trying to say, what are the things that aren't working and how can we get the confidence to share that and be practical about how we move forward together so that everybody feels safe to tackle the stuff that's not working and not just keep doing the stuff that doesn't work.
Yeah, absolutely.
Just before we welcome Barbara to the show, just one other thing that I was going to say was, I know that the Assembly, I mean, obviously there's been a lot in the news today about politics, I suppose, in the last week and stuff, and the reactions to things that are going on elsewhere in the world. Obviously, a lot of people are stressed about everything that's happening in Ukraine and all the things that are happening. there's a group called the Assembly, which, if people don't know, offers opportunities for people with learning disabilities and autism to get involved in issues to do with politics. And they've started, as well as their national get-togethers on a Friday and stuff, they have now got regional groups. So if you have a look, say on Facebook, and look up the Assembly and check that out, because it's another good opportunity to get involved and have your say.
Absolutely, and politics can sometimes feel like something that isn't for you. It's really common that people think, I don't think this is for me, but it is for everybody, isn't it? And it's really important that people are able to get their views heard and have their say.
We need to make it accessible, don't we? Because otherwise it's only a few people decide the future of the country. And I think that's something we've seen, is that some people say, oh, they're all the same. And that's not really true, is it? It's like you find folk that are closest to the things that matter to you. And if you vote, the more people vote, you know, the more chance they have of getting those voices heard. So, and
well, that sounds like a rather wonderful segue in. Oh, just a couple of links coming up in the bottom, just making sure we're sharing information and links to some of the stuff that we're talking about. So keep a wee eye on that. That's
the New Roots Home one. Yep.
Brilliant. Thank you.
Perfect. Okay, so that's perfect.
So speaking about making sure people have their voices heard and are able to influence decisions and be a part of something, that's a nice way to introduce our guest speaker today, Barbara Morton from Scottish Government. Welcome along, Barbara. Hi.
Hello, everybody. I'm really pleased to be here. I had a great time when I was here before, so I'm really looking forward to the next wee while.
Excellent. Thanks so much for joining us. So today, Barbara's going to talk a wee bit about what was found out after the consultation on the new National Care Service. So tell us, Barbara, how did it go? What did you find out?
Yeah, sure. No, well, overall it went really well, Pauline and Alistair. So I guess the top line summary of what I'm going to say is that a lot of people responded to the consultation. There was a lot of support for what the Scottish Government had proposed in the consultation, but also a great deal for us and everybody else to think about as we move towards a National Care Service. So can you remind me how long you want me to talk for just now, and I'll try and sort of adjust it accordingly.
Well, we're here until about 1:45, so maybe 15, 20 minutes, and then we'll hopefully get some questions, if that's okay. But
Sure, yeah, I'm really happy to do that. So hello everybody, my name is Barbara Morton. I work in the Scottish Government's National Care Service Division, and I'm speaking to you today from my son's bedroom, so you've got a great view of his posters on his wall across there. It's all about, I think, science basically, but if there's time at the end, I'll tell you a bit more detail what the posters are. And I'm just, normally my background is blurred, so I can just see it's maybe slightly messy in the background there. I think that's me actually, not my son. He's very tidy. So there you go. So as I said, I've been, Pauline and Alistair asked me to come along and provide an update on what the Scottish Government, what we found out from the National Care Service consultation, with a focus on what people told us about how they wanted to access care and support going forward, and on what support there would be for unpaid carers and for the workforce and personal assistance. But if anybody wants to hear about any other aspects of the consultation, please put in a question and stop me as I talk. And if I'm talking too long, perhaps Pauline and Alistair would give me a virtual sort of reminder under the table just to wrap it up a bit. So what I'm going to talk about is just a bit of a reminder for all of us, myself included, about what was proposed in the consultation, what people told us, and then a little bit about the next steps, although there's not a great deal to say on that just now. But before I sort of launch into all of that, I guess the one thing I'd like people to take away from the discussion is that the consultation that we ran last summer and autumn was just the first step towards a National Care Service. So the government has committed to introduce a National Care Service by the end of the current Parliament, which means I'm not very good at maths on the spot, but it's 2025, 2026 sort of timescale. So it feels like quite a long way away, and there has to be a lot more discussion and debate and talking before we get there to work out how it could work in practice. So I guess that's one key thing I wanted to say at the start. And also, and I said this when I was here before, that we know that people can't wait for a national care service to improve the way the system works at the moment. And we know there are lots of great organisations like In Control and, as you said, like the SDS Collective that you've just mentioned, who are really working hard to support people better. So just a couple of things that we're doing right now is we know we need to strengthen the way self-directed support works. It's not me personally that's doing this work, it's other colleagues. And we've announced that there will be a review of the statutory guidance for SDS. That probably sounds a bit dry and bureaucratic, but the statutory guidance kind of just sets out the main expectations for how it will work, and we want to review that to make sure that's as strong as possible. Because the independent review of adult social care said SDS was the legislation was really, really good, but the way it was put into practice wasn't so good, if I can put it like that. Well, it wasn't the way I tend to describe it is it's not what we would all want people's care and support to be.
Yeah, I was just going to say that's probably one of the trickiest things, isn't it? We have got such really good, clear legislation, and when questions have been asked, they've been clarified, and even with all of that really good legislation, it's often down to local interpretation. So you get some people really saying, this is what's being said, this is within, we have the right to do this in this flexible, person-centered way, and yet elsewhere, other people saying, "Oh, I'm not sure about that. We'll just stick to doing it this quite bureaucratic way." And I guess one of the challenges with anything like the National Care Service is going to be making sure that that's not the experience there, I guess, as well.
Yeah, exactly. So, as you said, Alice, that was one of the main conclusions of the Feely Review, really, that Scotland has a lot of good things in place, but it's how do you kind of make sure that the intention of the legislation that we have is how people actually experience it in practice, because we know from all the stories that we heard during the consultation period and obviously before and after that's not always people's experience, and it's not what we would all want it to be. I think everybody in the system would say that's not how we want things to be for people. So the other things that we're doing now is we are improving access to breaks for carers. We've announced an additional just over £20 million for local carer support starting this April. Don't ask me whether that's just for next year or over a period of years, because I have to go away and look that up, but it is £20 million and additional money to go into the Short Breaks Fund as well. And we have recently said that we will develop a carers strategy to look at how we can make support for unpaid carers meaningful and sustainable as we build out of the pandemic and going forward. So those are just a couple of examples of things that the government is working with people on now to try and improve the way that things work as we build towards a national care service. So just a quick reminder of what we proposed last August in the consultation paper. There were a range of proposals about how people, as I said, can access care and support, basically to overhaul the current mechanism, which is based on eligibility criteria. So we've kind of opened up that question. We talked about ethical commissioning needing to be in place to make sure that care is person-centred and human rights based, and also that there is fair work for care workers. And actually the whole thing about ethical commissioning is, I think, personally feel it's one of the main ways that we can kind of bridge that gap between what we all want to see and what actually happens in practice. We'd also made proposals around better regulation and better complaints systems to make sure that this works for people. And as I said, a whole package of things which build on what we're already doing around fair work in social care, but more support for the care workforce, training and development, attention paid to people's careers, and attention paid to leadership and management in the care workforce as well as for care workers. And what we said in the consultation was that we thought we could actually achieve a lot of these things within the current system, but to really bridge that implementation gap and to get that consistency of experience, we proposed that Scottish ministers should become responsible and accountable for social care, and that means a change, because currently it's the responsibility of local government, but we thought Scottish ministers should be responsible. However, with services being designed locally through new entities that would be built out of the integration joint boards called the Community Health and Social Care Boards. And this is what the independent review recommended.
So is that just to clarify then, when we talk about ministers being responsible and accountable, but services being delivered locally, what does that mean in practice? Would that just, is that designed so that somebody somewhere has got oversight over everything and is able to keep an eye on how all the different local authorities are doing it to keep things more consistent? Was that the idea behind it, or is there something else? What does it mean?
Yeah, that's the basic idea, Pauline. You've got it in a nutshell. That's really how it would work. So there would be the Scottish Government and Scottish ministers would be responsible for oversight, guidance, monitoring of performance at national level. But we're very, very clear that we feel that services should still be designed at that local level through the Community Health and Social Care Boards. In the consultation, we said if we were going to do this and make this change, it would make sense to bring adult social care together with children's services, justice, social work in prisons, alcohol and drug services, mental health services, but also community health care as well, so that all of that would be covered by the one umbrella and the one framework of the National Care Service. But before we go into too much detail on this, I just want to say, and I'm going to come back to this at the end, that a lot of that needs, and how that would work in practice, it needs to be worked out through further discussion and talking over the next couple of years. So I don't have all the answers today. I'm just kind of saying what we said in the consultation paper. So it was a significant consultation. Nearly 1,300 people and organisations responded. And we had nearly 300 very detailed responses where people and organisations gave us detailed submissions and detailed evidence as well. A lot of the individuals who responded had experience of the social care, particularly as family members of people who had care and support or as care workers. And we were just absolutely delighted with the level of response. We had a lot of meetings in the consultation exercise, about 100 meetings in total of various shapes and sizes, including 35 public meetings that were open to everybody. And we published a high-level analysis of the written responses on the 10th of February, just a few weeks back, and we published individual consultation responses on the 1st of February, where we had permission to do so. So we didn't publish all of the 1,300 because some people said, I don't want my response published. And in doing that, for those of you who haven't engaged with the Scottish Government consultation before, that's the totally normal practice that we do. So if we're going to introduce a big change like the National Care Service, we must consult. And we do an analysis report, and it's usual to commission that analysis externally as well. So it was an independent report. And it provides a very high-level snapshot, as I said, of all of those 1,300 responses. But what it doesn't do is provide a very detailed analysis of what each individual response said. However, it does provide us an indication of what people thought at the time last autumn, and if there's time, I'm just going to go through in a bit more detail about what the findings were for the areas which I think people listening to this are going to be interested in. So in terms of access to care and support, we asked quite a lot of detailed questions. You know, how could this work better? So people generally agreed with what we were suggesting, which essentially, or they agreed with that. This won't be a surprise, but people agreed that they and their family and friends and their carers must be involved in any decisions about care and support, that they wanted to be in turn supported by a community or voluntary organisation to make those decisions and to input into those rich discussions, and that the support provided needed to be what people need to live a full life and live independently. So that should be the criteria for what kind of support people get. And we asked the questions about who would you speak to, and this is a finding which I've been questioned about quite a lot, but the main type of person that people wanted to speak to was their GP, and that's been questioned, that's been put to me, why would you speak to your GP about social care? But that's what people said, so we have to go with that. But they also said they would be happy they want to speak to a voluntary organisation or maybe a national phone line or something like that. But there was a clear sort of in strength of view that they wanted to have somebody to coordinate everything for them, and that those conversations about care and support must be accessible. We'd talked about a kind of a getting it right for everyone approach, which basically means that all the different professionals that might be involved in deciding how somebody should be supported need to speak to the same language and be having that person at the centre of all the conversations. That's what it means. And there was a lot of support for that and for a single record, so people don't have to tell their stories over and over again. And as you might imagine, a lot of enthusiasm for something to be done to make sure that organisations can work together much more effectively.
I was just going to say that's absolutely. We spoke a little bit just before you joined about New Roots Home, which we're kind of working with kind of people who are in the most complex and messy situations where folk have long stay institutions or out of area placements, and that ability to kind of get every piece lined up in a very complex puzzle. You need the support, you need the belief that things can be different in the community, because people's behaviour and how they present in hospital is different, and and that human rights and that trust sometimes can be such a difficult thing, because you've got like people saying, well, this is my clinical governance and I have to be sure that but what's happening in the hospital isn't what will happen in the community. So if there's anything at all within, I guess, the National Care Service that helps to kind of create that space for people to coordinate that would be such a bonus, because the amount of money that goes into the misery of people getting shunted from place to place is just it's still one of the things I'm most sad about in social care, is that when things start going wrong, the slide, the whole house of cards can fall, and people just end up in awful places for such a long time.
Yeah, Alistair, that makes me sad too. And we do want to try and tackle that, but I think we don't underestimate how difficult that will be. And I think the getting it right for everyone approach was our suggestion for a way into that very issue, which is at least to make sure that all the different professionals are speaking the same language. And it was based on the I'm going to not remember this probably, but it was based on the framework for children and young people that grew out of work in Highland. And I think because in Highland, when they'd done all the work on GERFIC, they said, well, wouldn't it be great if this applied to adults as well?
Yeah.
And so that's the idea that we're going to run with. But as I said, all of this will be subject to these further discussions that I've talked about, and which I'll come on to at the end. If I'm just keeping on the time, I must make sure I get to that bit. So on unpaid carers, you'll not be surprised to hear that most people thought having a right to breaks from caring was a great idea. So that's something which we will be working towards. People felt that, and this was the same for the access to care and support as well, actually, that the kind of support you got should be obviously tailored to your needs. And on the access to care and support, people felt that the kind of conversation they got about care and support should be varied according to what level of support they needed. So somebody with very complex needs should get a complex discussion, which is obvious, isn't it? So moving on to the workforce, there was a lot of agreement with our proposals for making sure there's fair work in the care sector, which means good pay, good contracts, and training and development for people, as I say, and not just training and development for workers at the front line, but training and development in leadership and management as well. People responding made a very clear connection between how you value the people that work in care and the quality of the care that they can provide, which is obviously really obvious to all of us. And people said that this should be fair across all the sectors who are involved in providing care and support to someone. So there should be this parity across care, health, and all the different types of professional. So that's going to be a big agenda, which not me personally, but my colleagues are going to be working on. Also support for national level workforce planning, but a comment that how would you balance that with making sure that local needs, especially remote rural areas and islands in particular, are catered for. On to personal assistance now, because I know that's going to be of interest to people listening. So in the consultation, we basically said, look, personal assistants are a really important part of the care workforce. They enable independent living, they're the embodiment of self-directed support, but we need to find a way to value them and, for example, make sure that they're entitled to have the same level of training as anybody else in the care workforce, whilst also recognising their very particular role that they play in the particular relationship that they have with PA employers. We made a number of sort of detailed suggestions about better support and recognition for PAs, and those were generally supported. We had made a proposal about a register of PAs, and I know that is controversial and tricky, and there are different views about that. So there are some people who think this is a great idea, and there are some people who feel this is a real infringement of the right for independent living and the need for PA employers to determine what their PAs will do. So we still need to work through all of that, and there's no decision taken on that registration point yet. And we need to take a really broad range of views into account and figure out what is the best way to support personal assistance. So I think that's me covered the different areas that you asked me to, but I'm just going to stop a bit on the National Care Service itself. So you summed it up really well there, Pauline. I'm going to use that next time I'm speaking to someone about it. But as I said, you know, there was support for the idea that Scottish ministers should be ultimately responsible, but with local, what we call local delivery bodies, sorry, that's a bit of jargon for you there, but local organisations doing the actual planning of care, commissioning and delivery of it. Most people responding to the consultation said they thought this would make sure there were high standards for everybody across, and the same across Scotland, that it would make it better to share what works well, organisations would work better together, that there would be more guidance for people who access care and support and more guidance for care workers, and that there could be less rules and admin. But people also said they were worried that with such a big organisation like that, how would voice be heard? There could be too much power at the top. How would the change be managed? You know, what about if lots of staff leave the sector and people didn't want things to change for them where it was working well for them? How would the needs of remote, rural and island areas be really taken into account if they were part of this really big organisation? Really key questions about, okay, so where does that leave councils? How will local accountability work? There could be too much admin, too many rules, and how would data be shared in across such a big sort of system? And that the Scottish Government really needed to learn from other changes that had happened, say, for example, the creation of Police Scotland. And above all, that whatever happened, we mustn't lose sight of the main recommendation or the main sort of the core principle from the Feely Review, which is all of this has to be based on human rights. So both in what the National Care Service does and what the local delivery bodies would do, but also the way we go about developing the National Care Service, we have to put human rights at the middle of all of that. So what happens next? Well, as I said, the consultation findings that I've just outlined provide a snapshot in time for what and an indication of what the views of the public were and organisations and stakeholders last summer and autumn. A lot of what will be covered in what was covered in the consultation actually now needs to be subject to a more detailed process, which we're calling a co-design process. So basically more talking. Sorry, everybody. More talking, more discussion, getting under the detail of this, figuring out how all of this can work in practice. But the consultation findings are also going to be supporting decisions in government about what to do. So as I said, the Scottish Government is committed to developing the National Care Service by the end of the Parliament, and it means we need new legislation. So broadly speaking, the next steps are to develop that legislation and to start working out how it could work in practice. But I need to say the government has not yet decided what it will do. There may be a decision soon, but we don't yet have that decision. We are still committed to developing the National Care Service, but we're still really deciding what exactly to do based on the consultation findings. And so we want to carry on working with everyone. So that means working with the likes of COSLA and the health boards and other stakeholders, but also people and importantly, above all, people with lived experience to figure out what to do next. And I hope that In Control, Alistair, Pauline, and people listening are going to be part of those conversations. I think that's the end of what I was going to say, and I'm happy to take any questions or have some more chat.
Brilliant.
Thanks so much, Barbara. That was so interesting. And I appreciate you've tried to cram an awful lot of information into quite a short time. So we've already shared the link to the Easy Read consultation report in the chat. So if you're watching back, go and have a wee look at that and have a read through it when you've got a wee minute. But you meant, I've just got a few questions while we see if anybody else posts any online. But one thing that seemed to be a bit of a surprise was that people would prefer to access or talk about social care through their GP. Was there anything else that came as a bit of a surprise to you that you weren't expecting?
That's a good question. I think I can't bring anything strictly to mind. I think the thing that was quite surprising was just quite how much support there was out there for all of the things that we proposed in the consultation. And I suppose that shouldn't be a surprise because we based it on the Feely review. But we were quite, there was just quite a lot of support across all the consultation responses, but also a lot of caveats as well. And I think one of the things is people made some really good points about the sort of the National Care Service itself and this bringing together of community health, social care, adults, children's services, justice, and so on. People said, well, okay, but what about other services like housing, transport, education? How are you going to make those connections work? And obviously we had thought of that as well, but those were good points too that people mentioned. Going back to the GPs thing, I wouldn't read too much into it. I think it was just because we'd given a long list of options and that was the one that people chose. So, but as I said, that is definitely how that would work is definitely something which has to be sort of subject to this co-design process.
I think, sorry.
Next. Yeah.
I was going to say, I think that what's important that highlights is the need for really accessible universal services, isn't it? People aren't necessarily looking for a special place to go to talk about social care. They want people that they interact with really regularly to be able to understand it. And we talk a lot about how important it is to make everyday universal services as accessible as possible. And that sounds like that kind of message is coming through from that. So it's not just people like In Control Scotland who live and breathe social care and self-directed support every day. It's about making sure everybody understands what their rights are and what people are entitled to.
Mm-hmm.
And I guess one of the things I think that was really good about this as well was that how quickly the Easy Read came out. Because I mean, one of the things that I've certainly said for a while is that probably we should try and make the Easy Read come out at the same time as the standard version of these reports, because otherwise what happens is obviously the time windows for responding are sometimes quite small. And so I know that that's a challenge because obviously it takes a while to easy read stuff, but I guess you can easy read stuff as you're going along, so you're just adding bits in at the end. But I think that commitment to human rights and inclusion and co-design is so important, isn't it? And I guess with all of this stuff, it's about hearing the things that are difficult to hear. So the things where it hasn't worked, maybe not getting personally defensive about it, but actually saying, well, let's explore and understand why in this context what's happened before hasn't worked and make sure that it doesn't happen again. Because again, that's one of the other things that I think In Control Scotland has said is that the principles that we work to are not that complicated. Keep the person at the heart, human rights based approach, listen to the person, have a good conversation, don't have a medical model, really understand what the person's skills and gifts are, and then work away from that rather than starting with what can the service provide. And just so often when you've got so many people involved, it starts getting messy and people start saying, well, this is the bit that I can do, even if it's not a great fit. And so I think certainly that opportunity to mesh some of that together and create a safe space for people to explore that together would be hugely beneficial. My own personal worry would be just making sure that it doesn't introduce other layers of bureaucracy to it. If we can keep it really tight and close to the person, I think this could deliver such a lot of really good stuff, particularly the stuff about the social care workforce. It's so undervalued still. The pay is still so poor generally, and you spoke about ethical commissioning, for example. The lowest common denominator aspect of some aspects of tendering, although its quality is placed higher, it still features the value, and I think that's something that the social mobility of the workforce is much higher than it was when I first came into care, for example. So.
Yeah, I would agree. As someone who worked as part of that industry, writing tender bids for several years in previous jobs, I'm really excited about the idea of a different approach to commissioning, because it's just that there has to be more and better that we can do. And I think if the principles of the failure report are held at the centre of everything that is built and is developed, then that's the key to it, really, keeping those really core principles in place.
Yeah, we're really determined to do that, and to make sure we keep going back to the Feely review, and as you say, keeping those principles in place. I should have mentioned, I'll come back to that question in a minute. Hello, Keith. I should have mentioned as well, you'll probably be aware, we've set up what we call the Social Covenant Steering Group, which is a panel of people with lived experience who are helping us make sure that we keep to those principles in practice as this is developed. I think that's the best way to summarise it. So when will the main changes actually happen? I can't give you a lot of details just right now. I suppose I can only go back to what I said, which is that the commitment is, and this is subject to the decision that I said hasn't been made yet, the commitment is to introduce the National Care Service by the end of the current Parliament. I think we are really clear that that won't be the end of the change. So whilst the National Care Service might be established, there will need to be transition periods and a period of sort of growth and development beyond that. So I can't at this stage, Keith, give you a much clearer answer to than that. And as to the review of STS statutory guidance, I will go away and find out and come back to you. Yeah. And also take that point on board you're mentioning there as well, Keith.
Yeah,
absolutely.
He's on a roll now. We've got one last one from Keith. Here we go. The balance between national consistency of expectations and outcomes, as well as services and support that are locally relevant.
Exactly, and that's what we see working on STS, is that the same values and principles of the 4 options are really different in different areas of the country, because they have to be. They just have to be. So keeping consistency and locality matched can be quite difficult sometimes. But.
Yeah, something that the Minister, for Minister Kevin Stewart, has said, and I've heard him say this on a number of occasions, that one thing that he wants the National Care Service to do is make sure that he knows that there's different practice around the country, and he knows that for some people it's working really, really well. What he wants is to bring everyone up to the level of the high standards. So where it's working well, he wants everybody to be there. So it's not about kind of bringing down. So I don't know if you can see my hands waving around here, but it's about bringing everybody up, not bringing some people down. He's very, very clear about that. But how exactly we do that is, as I said, there has to be a lot more talk and discussion and getting people's views and involving people with lived experience in that.
Yeah, I mean, there's something else that I was just going to say that I've noticed is that's been a consistent issue, I guess, that's related to funding as well, is like short-term funding programs, that sometimes we can get obsessed with, what's new and shiny rather than what's good and working. And so short-term, it generates such a amount of work to redesign things that are maybe working really effectively. And it would be really great if, as part of this, as well as the ethical commissioning, we get some longer term stability for stuff, because again, it's quite a pertinent time of year, March, approaching into the financial year. There's a lot of rushing about with contingency plans in case things do and don't happen. And I'm aware that sometimes really good bits of work falter and fall to the side because they just can't sustain the demand for resubmitting, or it doesn't quite fit with a new priority. And it'd be really great if some of this could dovetail with that, so that we could protect really good practice that we know can see, has really good outcomes for people.
Yeah, absolutely. I'm not going to say too much, Alistair, on that specific point, but yes, no, that's noted, and that's been raised with Mr. Stewart as well in other fora too, and we definitely need to. I would agree that's something that we need to look at because of the really important role that third sector organisations have in the whole system in making it work for people. And you saw from the results there that clearly talking to a third sector or voluntary organisation or community organisation comes up high on people's list of people that they want to help them. So yeah, I can't say more than that though, sorry.
Thank you.
Watch this space, more to come. And like you said, this is really the first conversation about it all, isn't it? There'll be many, many more conversations over the next few years to fill in the gaps and build the detail and really, really flesh it all out. So it's a really exciting time to be interested in social care and to be interested in influencing and making change, because it really is a time when folk can have their voices heard and make some change in it. So I think we've probably run out of time. We could chat for ages about this. So just to say thank you so much, Barbara, for your time. That was interesting as always, and we look forward to hopefully getting you on again to tell us a wee bit more next time when there's been some more flesh on the bones. And yeah, thank you so much, and thank you, Alistair. And we'll see you first Wednesday of the month next month. So the first Wednesday in April, we'll see you again for our next monthly webinar.
Okay, thanks again. Bye.
Take care. Thank you. Bye.